Welcome to Global Economic Press, where we deliver trusted global finance and economic news, analysis, and reports, empowering leaders and investors with reliable, timely insights. I'm your host, Alex Brady. In today's episode, we delve into the critical issue of medical malpractice, focusing on the recent expansion of Silberstein and Miklos, PC's efforts in addressing misdiagnosis and delayed diagnosis claims in Manhattan. Join us as we explore the implications of these legal developments and their impact on patients and the healthcare system. Silberstein and Miklos, PC, a New York personal injury law firm representing victims of medical negligence, has announced an expanded focus on medical malpractice, misdiagnosis, and delayed diagnosis claims in Manhattan. The firm represents patients and families in cases involving allegations that physicians, hospitals, specialists, or other healthcare providers fail to recognize symptoms, order appropriate diagnostic testing, respond to abnormal findings, or otherwise meet accepted standards of medical care. Misdiagnosis and diagnostic delays can affect patients suffering from cancer, stroke, heart disease, infections, neurological disorders, internal injuries, and other potentially life-threatening conditions. A misdiagnosis may result in unnecessary treatment, while a delayed diagnosis can allow an illness to progress and limit available treatment options. The consequences may include additional surgeries, prolonged hospitalization, permanent disability, catastrophic injury, escalating medical expenses, lost income, and wrongful death. Silberstein and Miklos, PC, investigates these complex medical malpractice cases to determine whether healthcare negligence contributed to preventable patient harm. Patients and families concerned about a potential misdiagnosis or delayed diagnosis are encouraged to seek prompt legal evaluation. Early action can help preserve medical records, obtain diagnostic evidence, identify qualified medical experts, and protect important legal rights under New York law. For information regarding potential medical malpractice claims, contact Silberstein and Miklos, PC, at 718-204-8000, or visit https://ASK4SAM.net to schedule a consultation and learn about available legal options. Medical malpractice litigation involving diagnostic errors requires a detailed review of the patient's treatment history and the healthcare provider's decision-making process. Attorneys may examine physician notes, hospital records, laboratory results, imaging studies, pathology reports, prescription histories, referral records, and follow-up documentation. Medical experts can assess whether the healthcare provider acted consistently with the applicable standard of care and whether a reasonably competent physician would have identified the condition or ordered additional testing under similar circumstances. Cancer misdiagnosis and delayed cancer diagnosis represent particularly serious areas of medical negligence. Failure to identify warning signs, interpret imaging correctly, recommend appropriate screening, or refer a patient to a specialist may allow cancer to progress from an earlier, more treatable stage to advanced disease. Similar concerns arise in cases involving stroke and heart attack, where delays in diagnosis and treatment can result in permanent neurological damage, brain injuries, paralysis, or death. Prompt recognition and intervention can be critical to patient outcomes. Emergency room misdiagnosis is another significant category of medical malpractice. Emergency departments routinely evaluate patients experiencing chest pain, abdominal pain, severe headaches, breathing difficulties, neurological symptoms, infections, and traumatic injuries. Failure to properly evaluate symptoms, order appropriate diagnostic tests, monitor changes in condition, or respond to abnormal results can result in serious injury. Silberstein and Miklos, PC, examines the complete treatment timeline to determine whether emergency room negligence or other healthcare errors contributed to an adverse outcome. Diagnostic errors can also involve failures related to imaging studies, CT scans, MRIs, X-rays, laboratory testing, biopsies, and other diagnostic tools. Radiology errors, pathology mistakes, failure to review test results, and inadequate communication between physicians and specialists can contribute to delayed treatment. When multiple medical providers participate in a patient's care, determining responsibility may require a comprehensive review of communication records, referral procedures, and clinical documentation. The financial impact of diagnostic negligence can be substantial. Patients may require corrective surgeries, chemotherapy, radiation, rehabilitation, physical therapy, prescription medication, home health care, or long-term medical monitoring. Medical bills and future medical costs may be accompanied by lost wages, diminished earning capacity, and significant emotional distress. Medical malpractice claims may seek compensation for economic damages as well as pain and suffering, loss of quality of life, and other legally recoverable losses. Hospitals, physicians, healthcare systems, and insurance companies frequently maintain substantial resources for defending malpractice allegations. Claims may involve complex legal arguments concerning causation, medical standards, comparative fault, and the extent of damages. Silberstein and Miklos, PC works with the qualified medical professionals and other experts to develop evidence-based claims and challenge attempts to minimize liability for preventable medical errors. Medical malpractice litigation also serves an important role in healthcare accountability. Legal claims can identify systemic failures involving inadequate follow-up, communication breakdowns, improper documentation, staffing concerns, insufficient training, or failures to implement patient safety protocols. Pursuing accountability can encourage improved medical practices while providing injured patients and families with a legal avenue for seeking compensation. Silberstein and Miklos, PC serves patients and families throughout Manhattan and surrounding New York City communities. The firm represents victims of misdiagnosis, delayed diagnosis, surgical errors, medication mistakes, hospital negligence, emergency room malpractice, birth injuries, and wrongful death. Through detailed investigation, expert medical analysis, and strategic litigation, the firm remains committed to protecting the rights of patients affected by preventable healthcare negligence. For additional information regarding misdiagnosis and delayed diagnosis claims, contact Silberstein and Miklos, PC, at 718-204-8000 or visit https://ASK4SAM.net. About Silberstein and Miklos, PC. Silberstein and Miklos, PC is a New York personal injury law firm representing victims of negligence throughout Manhattan, Brooklyn, Queens, the Bronx, Staten Island, and Long Island. The firm handles complex medical malpractice matters involving diagnostic errors, delayed diagnosis, surgical negligence, medication errors, hospital malpractice, motor vehicle accidents, construction accidents, and wrongful death. Through comprehensive case preparation and dedicated legal advocacy, Silberstein and Miklos, PC works to pursue justice and fair compensation for injured individuals and their families.